important because it's when we have commenced training of the staff who man the points of entry, the health staff, supported by the partners who I just mentioned. And therefore this morning they have spent hours going through some sensitization in terms of preparing them for better case detection. Trained 60 health officers. We will be checking as we bring others from other stations. They'll also be running through that training, even as we monitor the intensity of this disease. Simple hygiene, wash, cough and cough away from other people, just simple basic hygiene.
The world is on high alert, reason being coronavirus, even as governments scramble to control the spread of the virus with surveillance systems on high alert at all entry points and health facilities, and screening being conducted to all those from affected countries. The contagious virus, which is a zoonotic disease, meaning it can be transmitted from wild animals to humans and even farther in human-to-human transmissions, has caused the death of more than 100 people so far, with nearly 4,500 confirmed cases of the virus worldwide in countries including the US, Australia, Japan, France and Germany, just to name a few. With no confirmed cases in Africa as of yet, the continent is still on high alert. Most recently, a suspected case was quarantined at the Kenyatta National Hospital. Through a press release by the Ministry of Health, the government waylaid fears, insisting that, quote-unquote, so far this is the only suspected case. Going further to highlight the surveillance system remains on high alert at all points of entry and health facilities, and screening is being conducted to all those from affected countries. And that's the big story tonight. We highlight the coronavirus in a bid to try and understand the root causes and what we should be afraid of if that's the case. Welcome to the big story. My name is Jesse Rogers. Let's get the ball rolling. I'd like to string in our lead reporter at this particular moment, Sophia Wanuna. Good evening, who will be having a conversation with Dr. Lois Achieng, who's an expert in this particular area. It would be interesting to pick her mind on this particular virus. Over to you, Sophia.
Good evening, Jesse. So the coronavirus has raised a lot of anxiety and fear around the world. Of course, China being the most affected, over 100 deaths reported there, over 4,000 people infected by this disease. And of course, here in Kenya as well, today reports coming through that there is one patient who traveled, an individual rather, who traveled from China to Kenya, and upon arrival and suspicion of bearing symptoms that's like those of coronavirus, was taken into Kenyatta National Hospital, is currently quarantined. And just a few moments ago, we received a statement from the Ministry of Health that confirmed this, that this person came from China because of the suspicion of these conditions, was quarantined, is undergoing treatment. So they're investigating to see whether or not, in fact, this is the coronavirus. So that is still a matter under investigation. But this evening, I have with me one of the doctors who was part of the team that got to look at this individual, who is a Kenyan, at least that we know, Dr. Lois Ombajo. She's an infectious disease specialist at the University of Nairobi. Thank you, Daktari, for making time for us. So, of course, I understand doctor-patient confidentiality. You wouldn't go and cannot go into the details of what this patient, the state they're in right now. But this is an issue you can at least tell Kenyans is under control to the extent of this case we've heard about?
Thank you, Sophia. So for sure we can say it is under control, as has been released in the statement. The patient was admitted into the infectious disease unit at the Kenyatta National Hospital, is stable, and the situation is contained as at this point.
Yeah. So let's go into what is the coronavirus. The country and the world, of course, talking about this. Remember a while back when people first heard about Ebola, there was all of this fear and stories and talk about what could happen, may happen. Break it down for us simply, what this is about and how it manifests.
Okay, so the coronavirus is one of the viruses that's often been associated with upper respiratory tract infections. So that would entail things like a running nose, a sore throat, or a cough. So there are many different types of coronavirus. The ones that we are often used to are the ones that cause mild respiratory symptoms in human beings. This time we have a coronavirus that seems to initially have started in animals, and the association here is because the initial cases observed in people who'd been in an animal market, and later researchers showed that the genetic makeup of this virus seems to be very similar to something that has been seen in snakes. So it seems that sometimes when these viruses change something about them, it allows them to bind to human cells. So there may have been some change that allowed it to shift to humans, and that's how the initial human cases happened. But as time has gone on, it seems that transmission is also being seen from human to human. And that's a reason for the concern. If you have a lot of people with an infection and it can be transmitted between humans, then we have reason to be concerned because it can spread from human to human.
Okay, so initially it was animal to human, so now human to human is more concerned. In terms of how it manifests, I've heard that it's like a flu. You'll hear it's either coughing, sniffing, fever. Talk to us more about the symptoms.
So the symptoms are like the usual upper respiratory tract symptoms. So someone may present with a fever, with a cough, with feeling generally unwell, maybe some muscle aches. They may have a running nose. So those are very like what we see when someone has a flu or a common cold, for example. So that's generally how it would manifest.
Yeah. Mm-hmm. For those now worried and concerned, what should we look out for? Because now you hear somebody cough, sniff, or you're like, oh, is that a flu or is that the coronavirus? What should we be looking out for? But combine that for me as well with, in terms of just hygiene, there's what we can do as well to ensure that if in fact we're in those kind of instances, those traveling, that they can be wary of.
Okay. So in terms of what to look out for now, we have something that we call a case definition. So a case definition would mean for this particular type of coronavirus, what's been called the 2019 coronavirus, would mean that someone has symptoms that suggest they may have this viral infection, but they've also had what we call epidemiologic risk, meaning either they have traveled from an area where the coronavirus has been found, or they've had contact with someone who has had the coronavirus. So in a situation, for example, if someone came from Wuhan, the Chinese city, which has been the epicenter of this outbreak, and presents with such symptoms, then we'd say this is a case definition. It doesn't necessarily mean that they have it, because we have to confirm that using lab tests, but that would be what raises concern. And if someone has traveled recently from China, or has had contact with a patient who'd traveled from China, or who had been diagnosed with this virus and present with these symptoms, then we have to put certain measures in place. And these are measures that we probably should be putting in place every day so that they become part of us, If you're sick, stay at home, so that you reduce the number of people who have contact to you. Wash hands frequently. Maybe we shouldn't shake hands as much as we do, though it's part of our culture. Just say hi, just wave. Let's wash our hands often. Wash our hands as often as we can. Or use sanitizers, alcohol-based hand sanitizers as often as we can. If someone is sick and if you have to have contact with them, especially for us as healthcare workers, we want to wear the appropriate gear, which would include a certain type of masks that prevents you from taking in any droplets that may be hanging out in the air. We want to ensure we are not touching these droplets, so you'll see us wearing a lot of protective gear and gowns. And after that, washing hands and keeping surfaces clean, and practicing cough etiquette. If you're coughing, don't just go blowing things in people's faces. Cough into your elbow, for example. Cover your mouth. Basically, basic hygiene things that we should be practicing every day. We probably need to be intensifying them now and being more aware of our environments. If you have a friend who's recently traveled and they fall sick, we should inform the authorities. There are a few numbers that were recently released. We could look them up later, and you can share them as well. That you can call those numbers if you have any reason to be concerned, so that you have someone from the Ministry of Health taking charge of the situation. ensuring that the infection control mechanisms are put in place and adequate samples are taken for the lab.
Right. I want to take you back actually to the case now under investigation at KNH, because I saw when the report was made that there's this one person who came in from China, has now been quarantined. Some wondered why just that one person? I mean, they were not in the plane alone. What about the crew? What about the other passengers? Shouldn't that have happened, that everybody should have been screened, or did that happen? And
So there are a number of things that the personnel at the airport do. So in this particular situation, they knew there was a patient who traveled and seemed to have some symptoms. So the concern is if you were in an enclosed space, like an airplane for a given amount of time, could there be potential exposure? And ideally what they do is they check everybody's temperature as they come in. If somebody also had a fever, then they would also be quarantined. For those who do not have fever, the ideal thing, it's impossible to quarantine everyone. We wouldn't have enough space to keep everyone. But if they have no fever and they have no symptoms, then it's good to educate them that this is what we're looking out for. Even if you go home, because you may still be what we call incubating, you know, that period between when you may have exposure but haven't started manifesting any symptoms. So if you're in this incubation phase, we don't know whether you're infectious or not. So in which case, we want to advise them to stay home as much as is possible. Avoid crowded places, avoid church or a funeral or a wedding, any crowded places where you could potentially expose more people. And you'd also, they take the contacts and they would call them daily to figure out, do you have a fever? Do you have any symptoms? In which case, if any of those people gets a symptom, then they'll be brought into the hospital and adequate samples taken. It would be very difficult to quarantine everybody who came in. If a flight has 200 people, it would be impossible to find a place to keep 200 people and wait and watch them to see if they develop a symptom. So that's sort of how they would be handling such a situation.
But as a medical practitioner, in your view with what's happening in China with this virus, would you recommend, I wonder, to first stop flights from China because just of perhaps the danger that poses in as far as you said, you can't quarantine everyone. Do we have the kind of capacity that if in fact this became more serious, that would portend for the country?
I think that's a question we are sort of all asking ourselves. It's often difficult to have the right answer in such a situation. Remember, one, there are very many Kenyans in China, either students or traders and all. And at this point, they're all wanting to come back home, and not surprisingly. There's a lot of maybe trade and other things that happen between countries, so that stopping flights, I'm sure, has repercussions beyond what we can imagine. And I'm sure the authorities will be keeping an eye to see at what point does it reach a certain threshold where we say we can't handle this. For this particular one, it's difficult because several cases are now being reported in different parts of the world. So will we have a lockdown from every part of the world?
So it's not just China?
It's not just China. There have been other cases that have been reported, not as many, but you have cases from the countries surrounding China. You've heard of reports of about 5 cases in the US from travelers back from China. So it's something that I think have to keep an eye on. I'm sure the authorities will be keeping an eye on it and advising as time goes on.
Finally, in terms of the capacity in Kenya, the Minister, C.S. Kariuki, I think it was sometime last week, talked about Kenya is prepared, is training her officials to what to look out for, what to watch out for. You're confident that we, however way this matter and that is in hospital goes, that we can handle this?
That's a question for the minister. But I think at this point, every hospital is sort of putting certain measures in place. And most of the measures are fairly simple. It's around when someone first comes in. If someone has respiratory symptoms, can you put them aside so that they're not mixing with everybody else? Informing the ministry in good time so that adequate samples are taken and, appropriate alerts and awareness is raised. But in many infections, we are as strong as our weakest link. So it doesn't matter how much the hospitals do. If we don't do our part in the community, then we're not going to win very much. So if we all do what we should do, practice cough hygiene. If you're sick, stay home, wash hands, keep your environments clean, then we're a step closer to winning this. But in terms of training, I think at least as far as I know from the places where I've been, a lot of healthcare personnel, awareness is being raised. There's always a concern about such new infections because people don't know that much about it. Everybody is learning on the go. So we really just have to be vigilant and do the things we should do right. Hygiene. Yeah. Sophia.
Thank you very much, Dr. Ambajo, with us here on The Big Story. So it's all about all hands being on deck and everybody doing what they need to do and remaining vigilant, of course, for those traveling back and noticing these symptoms that have been highlighted, seeking medical attention, of course, staying away from crowds as we've heard from Daktari, but definitely one will continue watching this story. Jesse.
All right, many thanks, Sophia Wanuna, right there. Interesting conversation. So we need to be vigilant and definitely observe basic hygiene, not going as far as, or rather going as far as waving, avoid shaking hands, and as well as washing our hands even more frequently. But we'll definitely get to the gist of this particular conversation as I will be interacting with a couple of guests, a couple of specialists in this particular field. We'll be talking to the World Health Organization representative in Kenya, Dr. Rudy Eggers, who will also shed light on this, as well as Professor Omu Anzala from the Institute of Clinical Research at the University of Nairobi. And later on, we'll be joined through phone by James Onsongo, who is the acting head of Health, Nutrition and Social Services at the Kenya Red Cross. So we'll try and diverge into this particular coronavirus as much as possible, just trying to understand and how we can actually differentiate it from a common cold, because if you look at the symptoms, it's quite so hard to differentiate it from that. So I'll start with Professor Omu Anzala, who should be joining us from our city center studios. Professor, a very good evening to you. It's good to have you with us, I must say, because people are trying to gauge how worried they should be, not just internationally, but here in Kenya as well. My question: how do we isolate this particular virus from a case of common flu? Locally, it's called homa, because we usually overlook it at most times. What is a potential danger?
Okay, thank you so much for having me here. Respiratory infections are common. Influenza is one of them. What we are now having as coronavirus infection, the one they are calling the 2019, also presents like flu. You start with upper respiratory infection, you can't breathe. Really, the first thing is what has been discussed and what has been said before, is that if you are coughing, if you are having high fever, if you are having a running nose, those is the beginning. But to be able now to differentiate these particular symptoms from any other thing, one actually has to make a very clear laboratory diagnosis. Because what we are saying, even if you are taken to isolation, we are only going to get to know whether you are carrying this particular virus through a laboratory diagnosis. And that means collecting samples from the respiratory tract, the secretions, at the same time collecting blood and actually subjecting this to very intensive laboratory work to give us a clear indication that is it the 2019 coronavirus or is it something else.
Just help me understand it here. With the little information I've gathered so far, it is a virus. Are there possibilities of mutation as well? And also, is there a case of antiviral treatment or a vaccine against it yet?
Calling it the 2019 novel, it means it's a totally new virus. This brings us to the discussion we want to have in terms of One Health. For the last 15 years, the whole issue of One Health has become very important, and also putting that into the realm of epidemic preparedness. One Health means diseases that are in animals that can be transmitted to humans. These could actually be diseases that are in the wild that are transmitted by vectors, or diseases that are in the wild that are transmitted by contact between humans and animals. This particular new virus, the coronavirus 2019, first and foremost, China has worked very, very hard, and the international community, to come up with ability to diagnose that virus. The news reaching us is telling us also working very hard to bring together a vaccine. Currently, there is really no antiretroviral drug for this particular coronavirus or for any other coronaviruses that we know of. Although there are 2 antiretroviral drugs that have been tested, but we don't know whether they actually work very well. These actually require clinical trials. As for now, really, there is a diagnosis. We can look at blood, we can look at respiratory secretions, but there's no vaccine. Treatment is actually symptomatic. You manage the patient in isolation, and you ensure that you manage the fever if it's there, you manage the diarrhea if it's there, you manage the respiratory distress syndrome if it's there, and eventually the patient will recover.
You raised the point of symptomatic. Allow me to ask, is it asymptomatic at any particular point where the symptoms are not visible? You know, we cannot actually pick them out, especially during that particular incubation period.
Yes, the difficulty is that the epidemiology of this virus is still evolving. We know that the incubation period is about 2 to 7 days, meaning from the time you get exposed to the time you begin to show the signs and symptoms of the disease is about 7 days. But there is also information coming in that out of the number of people who get infected, some have very mild symptoms. We are also not sure whether during this incubation period, before you come down with signs and symptoms, you can transmit the infection. So there are still unknowns because the epidemiology is still evolving, but the whole issue is to become, for all of us to be very, very cautious, be careful about the travelers who have come from Asia, take into account any early signs of fever that might be there in somebody who gives a history of having traveled, ensure that we are actually covered. So the epidemiology is evolving, but viruses are actually known to actually be secreted and transmitted even before the signs and symptoms, and hence the need for isolation and the need for taking precautions.
All right, thank you, Professor Anzala. We'll get back to you. Allow me to engage Dr. Rudy Eggers, who is the World Health Organization representative right here in Kenya. Good evening, Dr. Ari. Now, the WHO has declared coronavirus, or rather has declared the coronavirus high risk to other countries, admitting it made a mistake earlier on of making it a moderate, you know. And we do live in an era of global travel, we must say. But my question is, what does it speak to the contagion factor? And is apparently there any progress in terms of getting a vaccine or antiretroviral treatment?
Good evening to your viewers. Currently, there's no treatment against this virus, also no vaccine, as your previous speakers also alluded to. So currently, what the treatment entails really is making sure that the patient is comfortable, is given enough fluids, like you would treat a flu. Unfortunately, there's no specific treatment for this virus as yet.
Okay, let's go into the details now. We well know that it emanated, or it rather started from China, Wuhan to be specific, and it is a big town accommodating over 1.2 million people. It's also known to be a college town, over 70 universities in that particular town as well. In terms of managing the spread of the virus, we well know there's no confirmed case of the virus in Africa, but what do you think, in your view, should be the things put in place by various governments to ensure that we do not have an isolated case in Africa?
So first, it's very important that the public understands how this virus is transmitted. So this is a virus that's transmitted similar to the flu virus. So it's actually spread by aerosol, people sneezing or coughing, or the secretions from the nose. Once those droplets are in the air and other people breathe them in, that is how they get infected. So that's the main route of transmission for this virus. So the best way is that one can avoid getting ill or getting transmission of this virus is really to look at basic hygiene precautions. So washing of hands, because you constantly are touching your face or your mouth. And for those people that are coughing, to actually cough into a handkerchief or actually into the elbow. And those people that are in a situation where there are many people coughing, like in China, of course they start wearing face masks, so to protect the air that one is breathing and the secretions that you cough out. So those are the main ways that you would protect yourself in a personal way. For countries such as Kenya, it is very important to screen incoming people from China, because this disease is occurring in China. We know that of the 2,761 confirmed cases, that almost all of these cases, there are just a handful that do not have a link directly to Wuhan and to China. So we know that there's a very strong link. So a country like Kenya, the first thing, of course, is to make sure that the screening procedures are in place. And indeed, they are in place at the Jomo Kenyatta International Airport. And patients or passengers that actually arrive here from China are screened for high temperature. But also passengers that have got symptoms such as cough or a high fever or sneezing or runny nose, sore throat, these should also be examined by the port health authorities. And if there's a suspicion that these passengers are infected with a virus such as coronavirus, then they are kept aside and they're kept in a holding room initially. And if there's information that they are coming from China, they would then kept in isolation until it can be proven one way or another that they are infected. So you would have to do a laboratory test on this patient to be 100% sure if this is a coronavirus or not.
Okay, Professor Anzala, thank you for your patience. Now, let me cross over back to you. We have the virus spreading to people who haven't even been in China, obviously not in Kenya, but on cases of people-to-people transmission. What should governments do in their capacity, according to you, to ensure that this is not a repeat of what we saw 17 years ago with the SARS virus, which is sort of similar to this? Over 8,000 people died, almost over 8,000 people rather were infected, with 800 people, succumbing to the SARS virus. What's your take according to this?
Actually, thank you so much. Is clear and straightforward. We know that this is a virus that is spread by a droplet infection. We also know that it's also spread by contact. So the measures that we really want to ensure we put in place is exactly what has been discussed. One, that we must be alert. Anybody coming from the Asian continent must be screened at the airport by looking at fever. But secondly, we must make sure that if there's anybody with fever, that person is isolated. A quick diagnosis is actually made. But for the rest of us, we should actually ensure that we wash our hands on a very regular basis. We avoid contact. We avoid anything that is likely to get us infected, because it's droplet and contact. And also the critical aspects of it is the clinical healthcare workers. People are going to be coming to hospital, so we need our healthcare workers totally trained, and we need our healthcare workers in hospitals to actually ensure that they put in place all measures to do with hospital infection control. Washing hands, putting on gloves, ensuring as they move from one patient to the other, they clean their hands, the gloves are removed, and all those aspects. Anybody who is under suspicion, they are totally put in isolation. And when healthcare workers go there, they have a mask, they have a gown, and all those things that are used in that room are actually left in that room. And in that way, if we put all those measures in place, we shall avoid human-to-human contact.
All right, Professor, just a quick question. We had an isolated case, that particular student, the Kenyan student who came from China and landed at the Jomo Kenyatta International Airport. Yes, it hasn't been confirmed, but my question is, and I'm sure other Kenyans were also asking, in terms of the human-to-human transmission, should it have been wiser to also isolate the other members in that particular flight to just ensure that in case it is, in the worst case scenario, in case it is the coronavirus, it would be easier to manage it? What exactly are the screening measures at the airports, and how should we look at it going forward?
Yeah, usually the screening measure at the airport, for example, this particular condition is to, first of all, look for fever and look for anybody who is coming in with a cough. It was good enough that it was clearly known that this particular patient had contact with the particular city in China where this infection started. So that isolation of that particular individual with signs and symptoms is the right way to go. The rest of the individuals who are coming in, the passengers, would have all their temperatures taken and all their contacts actually taken. And all these passengers would have actually been given information to be told that in case they feel sick, fatigue, any form of fever or any other cough, they report to the nearest healthcare center as quickly as possible. So what was carried out was clear. I'm sure all the contacts in this particular plane are known to the healthcare, the Port Authority. This particular patient is actually now in isolation, and I'm sure that the contacts, the Port Authority should be calling these individuals just to ask whether they have any problem so far. So for me, whatever was the right thing to do. You can't really quarantine everybody else who has no signs and symptoms, but you can educate them and follow it up very quickly with a phone call. Educate them that if they have these particular signs and symptoms, they should move to the healthcare facility as quickly as possible.
All right, many thanks, Professor. We'll definitely continue with this particular conversation even as we get to engage our other guest who is on phone as we speak. Let's just take a short break right now. You're watching The Big Story. We'll be back with this conversation, just highlighting more details about the coronavirus. Stay with us.